Before 2008, there were no home birth protocols from the Ministry of Health. In 2008, the Ministry of Health passed home birth protocols that are for the most part not evidence-based. They're arbitrary and they're meant to restrict home birth. The ones that they're going to pass now are completely arbitrary, that have no rationale at all, such as how big a room you need to deliver a home birth, such as needing a doctor to say you're sane, such as not being able to have a 6th or 7th birth at home on a healthy woman. They're not based on any research. They're meant to restrict home birth, and that is coming from the Ministry of Health heads, such as Dr. Yaffe from Bikor Cholim, such as Dr. Shoshana Riva, the head of the nursing department, whose aim is to completely eliminate all planned attended home birth. As a result, they will certainly get unattended home birth increasing. This has been coming because home birth used to be a very, very marginal activity, but last year there were 750 planned attended home births, and because of the small increase, they want to cut it down before it grows. I'd like to ask this couple's opinion why they think this is so.
Well, in my opinion, it all, as the old saying goes, let's follow the money. I know in Israel to have a baby in a hospital costs approximately 11,000 shekels, which would be...
The hospital loses 11,000 shekel every time a woman gives birth at home.
That's right. So that's the cost. There's a cost involved. When we had our twins, who are now 7, when we had them in a hospital in Florida, our bill came to $8,800, which is approximately 32,000 shekels thereabouts. So this is about money. That's the bottom line. This is about money for particularly, I believe, for the pharmaceutical companies, and then there's a knock-on effect to gynecologists, to the hospitals, to the private hospitals, and even the public hospitals. And as Judy was talking about, these measures are meant to restrict home births. I think it goes even further. The main idea is to prevent home births, because the regulations are so intense that in reality it's almost impossible to have a home birth. These huge corporations influencing politicians to pass rules and laws and regulations that will increase the profits for their shareholders, so their CEOs can get bigger bonuses. And this is what I think the main problem is. It's money. It's money. When a baby is born at home, a pharmaceutical company doesn't make any money. And when these people, when the CEOs of these companies have got such clout in Washington and in many of the Western countries, they're able to pull strings. And this is the result, that births are being endangered.
In the hospital up in Cork, in our whole county, there's only one maternity hospital, and it was built and designed for 6,000 births. And as of the latest figures, they have over 9,000 births per year. And it's a well-known fact that when you go up, you can't get a room. They have you labor in the hallway. They are understaffed, and now because of the economic situation in Ireland, they are laying off more nurses. And so you don't want to become the next statistic. You don't want to go up. You know, you enter the hospital and they have warning signs about RSVA.
MRSA, superbug.
Yeah. When you go into hospital, you'll see all these warning signs about MRSA, the superbug, and how to protect yourself. And for me, as a mother going to give birth to a baby who is very fragile, and why would I want to have a baby born into that environment where he could catch a disease or an infection? And I think a lot of women, you know, when you say you're going to have a home birth, they're terrified. And maybe it's because of the way birth is portrayed in hospital, where maybe it's the way that birth is portrayed on television, where the women are screaming and in so much pain as if they are overwhelmed by the process. I think most women, perhaps maybe even most doctors and nurses, have never even seen a natural birth and know what to expect. And if women could get beyond that fear, and I think once they have that taste of what natural birth is like at home, in the comfort of your own home, where you're relaxed, and you know, and you become kind of part of, it's hard to explain, but it's part of what a woman is. That biological ability to give birth is part of who she is.
I have a friend back home in Ireland whose grandmother was a midwife for 35 years. And when she passed away some time ago, they went to the attic and found her ledger. She kept meticulous records of all her births. And out of 2,100 births at home, without a doctor present, there was one fatality out of 2,100 births. Therefore, you have to come to the conclusion that home births are safe. And I think we need to remember as well that hospitals are a new invention. They're only around about 100 years. For eons, for millennia, people were born at home.
Naomi made an amazing statement right before we sat down, which was, if a birth where the baby needed some help after birth, this was the birth where they reported in the papers that there was a critical condition and a terrible outcome. If every time a hospital birth ended in death, that they closed the hospital, we wouldn't have any hospitals, and we wouldn't have any doctors.